Hello everyone, this is Jordan Dunn. Welcome back to my channel. So the main motivation for me to do today's video is about is that herd immunity is not gonna happen. So we need to prepare. Everyone living in the Western world should be prepared to be infected in the near future at some point. So how can we minimize the potential risk after we get infected by the COVID-19? So in the previous episode, I have covered the function of calcium supplementation, and in this episode, I'm going to present the significance of the Zinc supplementation, about how it could boost our immunity and prevent the potential inflammation. Besides, something to do with the recommended dietary allowance, which is how much dose do we need daily. Now let's begin. So firstly, cover in the Lancet infections sections. The title of the article is Zinc and Immune Function, Biological Bias of Altered Resistance to Infection. So it has been clear to show that the zinc affects multiple aspects of immune system. So for example, in this paper, it has been shown that the level of zinc in our bloodstream is positively correlated with the number of neutrophils and natural killer cells until surpassing the suboptimal level. So what is neutrophil? Is white blood cell and natural killer cell. Both of them is a key indicator mediating the non-specific immunity, and zinc deficiency also affects development of acquired immunity. For example, the activation of T lymphocytes, B lymphocyte helper, which is responsible for the activation of more T lymphocytes to prevent the potential infections or inflammation things, and also the B lymphocyte development and also antibody production, such as the immunoglobulin G, will be compromised once the individuals is in a state of zinc deficiency. So what is immunoglobulin G? Which it is a important indicator when we performed PCR testings in detecting the COVID-19. When the immunoglobulin is high, which the result tends to be positive, and which is a really clear sign of being infected by the COVID-19, and also the macrophage, which is the big cell to engulf the necessary invaders. So the basic cellular function, and zinc also been shown that it could inhibit the DNA replication of the virus, and also the RNA transcription, cell division, and cell activation. Four of them are really important for the virus expansion within the body. But in fact, some people would ask that the more I take zinc supplementation, the healthier I will be. In fact, this is wrong. We have to find the optimal level of zinc to boost our immunity to the largest extent. Optimal zinc states have an increased risk for infectious disease. For example, if the level of zinc in our bloodstreams is higher than the optimal level, which means our immune systems is stronger than before, which will cause the autoimmune system disorder. But when the zinc level within our bloodstreams is relatively lower than optimal level, which is one cost of the cancer development. And in fact, the risk group for zinc deficits is pretty similar to the calcium's deficit group, which is elderly and patient with various inflammatory autoimmune disease. According to the data published in the WHO, zinc is responsible for 16% of all deep respiratory infections worldwide, and about 1/3 of world population is affected by zinc deficits. And zinc directly inhibits the viral replication. For example, the coronavirus, P. coronavirus, papillomavirus, and also the notorious HIV. And also the zinc could prevent the fusion with the host membrane, because from the perspective of virus infection, in order for the coronavirus to replicate and infect a larger area of patient's lung, it has to perform the fusion with the membrane to infect a larger area of the lung. But in fact, zinc could prevent the proceeding of this process. And also zinc could decrease the viral polymerase function. What is the viral polymerase? It's kind of vital enzyme for the viral RNA production, and also destabilize the viral envelope. What is the viral envelope? Viral envelope is the layer that cover the outer faces of the virus, which makes the virus more susceptible to the antibody. And also, zinc balances the immune response during infectious disease. As I mentioned before, when the zinc level is too high, it will cause the hyperinflammation relating to the overproduction of cytokinase, which is a highly pro-inflammatory factor. As a result, it will cause the acute respiratory distress syndromes. As for the hypoinflammation, it's just the level of zinc within our bloodstream is relatively lower than the optimal level, which will cause the cancer. Of course, I've mentioned that. Also, the zinc supplementation can reverse the lymphopenia. What is lymphopenia? Penia means low, which indicates the fact that the lymphocyte, which will decrease. The lower level of lymphocyte, which is responsible for our immune function, and signals the cascade of T cell receptor as second messages. So what is the second messages and the T cell receptor? So this is our cells. This is the T cell receptor, and T cell will be attracted by the B helper cells, and they come here and engraved into the receptor and causing the T cell to attack the virus within the cell. And this process that we named it in physiology as the co-activation. And zinc is required for B cell maturation and function. Back to the topic, is about zinc and calcium have to be reached the optimal level before getting infected, because it approximately takes a month to a month to wait the zinc and calcium level to reach the optimal. When an individual gets infected, it will be too late to ingest zinc and calcium supplements. And the data have been shown that has been shown that for the patient who are admitted to the hospitals, the intravenous infusion of zinc and calcium that do not prevent the development of the coronavirus symptoms. And so, in fact, in conclusion, the prophylactic supplementation is more effective than the therapeutic proceeding. So, lastly, the recommended daily allowance, which published in the webpub, you can check it later on. For the boys and men age 14 or older, the recommended dietary allowance is about 11 milligram per day. For women from 19 or older, is about 8 milligrams per day. For the pregnant woman, is about 11 to 18 milligram per day, and for the lactating woman, is about 12 to 14 milligram per day, which is relatively higher than the rest of the previous group, except the boys and men, because of course the lactating would cause the potential deficiency of zinc and calcium. Okay, that's pretty much everything about today. Thank you for watching. I will see you next time.